morning, everybody, and welcome to the first Iowa Flex Program Flex Call of 2020. We're right at the top of the hour, and out of respect for everybody's time, I'm going to go ahead and get started. I'm going to kick us off with just a couple of housekeeping items at the top of the session. A reminder not to mute your phone lines and to not place the call on hold if you need to step away from the session. To utilize the chat box for questions and comments you have as you think of them. We'll be addressing them throughout the session and again at the end. Also, just a reminder that today's session will be recorded and transcribed. It will be sent out to all attendees registered for today's session and additionally posted to the iCompass platform if you need to access it at a later date. If you have not received the link with today's slides, you can find them in the chat, and they'll be posted to that web page. So in today's first Flex call, we're going to go through a pretty general agenda. We're going to introduce today's speakers. We want to start the session by kicking off and introducing the Flex Program Coordinator for the state of Iowa, Cassie Kennedy. She's going to be providing just a general overview of the Flex program at large, and then we'll be digging just a little bit deeper into the MBQIP portion, kind of the quality improvement arm of Flex, trying to give you a better idea of what to expect moving forward, the nuts and bolts of what's changing and what's not. We're going to review the fiscal year 2020 minimum reporting requirements, the current MBQIP measure domains, and then take some time to walk through the most recent changes to the EDTC measure set. We want to spend some time sharing with you how we plan on approaching dissemination of your MBQIP quarterly reports moving forward, and then share with you some of our team's top picks for key tools and resources, and make sure you know how to find them when you have Flex-related questions. Finally, close out this session with sharing our plan on how we plan on communicating with you moving forward, and probably most importantly, provide you an outlet to ask any questions you have as the program transitions and as we get prepared to work together on Flex MBQIP work in 2020. So with that all in mind, it's my pleasure to introduce Cassie Kennedy. She joined the Iowa Department of Public Health as the Flex and SHIP coordinator in April of 2019. She's been there almost a year. She's got her bachelor's degree in biomedical engineering from the University of Iowa, and she's currently pursuing her Master of Public Health degree from the University of Nebraska Medical Center. Prior to joining IDPH, she worked as an accreditation coordinator for the Foundation for the Accreditation of Cellular Therapy, working with hospitals and cord blood banks around the world to meet quality standards around blood and marrow transplantation and cord blood banking. So with that, I'll pass it over to Cassie.
Good morning. So as Kate mentioned, I'll just kind of provide an overview of the Flex program. So here you can see the different Flex program areas. So the Flex program is composed of 4 areas, which are quality improvement, financial improvement, operational improvement, and population health. It should be noted that MBQIP is only part of the Flex program. More specifically, it's part of the quality improvement area of Flex. So in order to participate in Flex program activities, including the financial improvement, operational improvement, and population health activities, hospitals must submit MBQIP data. So that is the only required part of Flex. So that's kind of your ticket into the other Flex program areas and opportunities. And as a little background for how the Flex program is funded, the Iowa Department of Public Health applies for the Flex program grant through HRSA, and then we are awarded the grant. Then the department uses this funding to contract with organizations to provide these Flex program activities. And through this process, here at the department, we use a competitive application process to select the most qualified contractor to provide these services. And this is why you might see the contractors change from time to time for the Flex program and then also the SHIP program. So as you may know, previously Stroudwater provided the Flex program activities. But now, as you can see, for the next 4 years, IHC and Hometown Health will be providing Flex program activities in those 4 areas. So IHC will be providing activities related to quality improvement and population health. Hometown Health will be providing activities related to financial improvement and operational improvement. And here at the department, we will be providing oversight of the Flex program as a whole, and then also some population health related technical assistance. And then on the next slide, it just shows, oh yeah, here on this slide, it's kind of an overview of the Flex program activities that will be offered in each area. So in summary, the activities are focused around providing education, webinars, live meetings, and technical assistance. IHC today will be discussing the quality improvement part of Flex. Details on the financial and operational improvement areas of Flex were provided in the kickoff webinar on January 28th. And if you would like additional information about the financial and operational improvement or population health parts of Flex, or if you want a link to the kickoff webinar recording, please let me know. And then also, if you have any questions or comments or suggestions about the Flex program, please feel free to reach out to me, and I'll provide my contact information in the chat box if you don't have it already. Thank you.
Thank you so much, Cassie. And so I just want to take a moment to pause and give attendees a chance to chat in. Our team at IHC recognizes through our work with you in the HIN and also just in some preliminary discussions after IHC received this award that there's a lot of confusion regarding the Flex program at large. And I think some of that has to do with there being several components to the Flex program that are individual and have individual goals, but kind of all play into the overarching aims of the Flex program nationally. And so just in recognition that, you know, some of you are newer to your role in the past couple of years, and this, you may not have heard this information recently, we just want to allow you a chance to ask Cassie any questions you may have about either the national or state of Iowa Flex program. And just pausing to give everybody a chance to chat in, I would just add that we'd be happy to, in follow-up to this session, when we send out today's recording and slide deck, we will include the Flex program kickoff call from January, a link to that recording and slides in the follow-up email for your reference. Not seeing any questions in the chat, we're going to go ahead and move this forward. But if you think of something, Cassie's planning to stay on for the call. She's chatted in her contact information in the chat box, and we encourage you to reach out to her or to her through our team if you think of a question. So I think actually I have the privilege of knowing most of you. My name's Kate Carpenter. I'm the Director of Hospital Services here at the Iowa Healthcare Collaborative and lead and direct IHC's hospital-based initiatives. And so today we're going to get to talk to you a little bit about how IHC is planning to support you with your MBQIP work moving forward. Hopefully you've been receiving our emails, but on February 20th, just a couple weeks ago now, IHC was awarded the support contract for MBQIP by IDPH, as Cassie mentioned, and that this support contract was previously held by Stroudwater. We want to help you connect the dots and kind of who was doing that work before and who is doing it now. And I think most of you are familiar with IHC through your participation in the HIN, but I think while these two programs are certainly complementary, I think we'll have a really great opportunity here to create synergies between both programs. They are separate in scope, and so we'll be connecting with you individually and sometimes maximizing our engagement with you to cover kind of focus areas from both programs moving forward. And so with that, you know, in recognition that we are in a transition period, it kind of makes people wonder, understandably, well, okay, what's changing and what's staying the same? And so the intent of the next couple slides is to just give you some bulleted points on what you could expect from us. Hospitals will now request assistance through IHC instead of Stroudwater for any MBQIP or FLEX related questions. Hospitals will now receive their quarterly MBQIP data reports electronically from IHC instead of Stroudwater or the Iowa Department of Public Health. And that you'll receive MBQIP or related FLEX communications from the team here at IHC moving forward. What's not changing? So there's, while there are some things that are certainly changing, there is a lot that is not changing. Hospitals will continue to report their EDTC measures into the IHC online reporting database. And I think most of you are familiar with the database. It's accessible through the IHC webpage. If you need assistance finding that, I would encourage you to either chat into us now and or use our contact information at the end of this presentation to reach out to us so we can be sure to assist you right away. It's important to know, and we'll talk about these in the slides forthcoming, that EDTC measures had changed starting with 2020 encounters, but the mechanism in which you report that data is still the same. You'll continue to have access to MBQIP related technical assistance, resources, education, training, and meetings that you're accustomed to. I think in all transparency, February 20th wasn't that long ago, and so we are taking a little bit of time to sort of evaluate what's working for hospitals, what's not in this program, maybe what are some opportunities that we might have moving forward to help fill some existing gaps for you. And so we've engaged with several of you in conversations to sort of learn what would be most helpful. How do you envision this going forward? Because we want this very much to be a partnership. But the important thing to know is those offerings will continue to exist. And finally, that all FLEX program support contractors, including IHC, will continue to be supported by the FLEX coordinator at IDPH, Cassie Kennedy, who you just heard from. So all of those things remain the same moving forward. And so we thought we would spend a little bit of time on our first FLEX call, kind of going back to basics and reviewing what currently are the minimum reporting requirements to meet eligibility for MBQIP. And we know from working with you that this is another point of common confusion, and for truthfully a lot of really good reasons. One is that, as you can see from the table provided, these requirements, these minimum reporting requirements, have changed over time, right? So it's like as soon as you get used to one set of rules, the rules change on us, and it's like, whoa, when did that happen? I thought it was X, Y, or Z. And so another complicating factor, I think, to the evolution of reporting requirements is simply that they happen on a fiscal year basis, not necessarily on the calendar year. So things up and move on you in the middle of the year in the fall because they're based on physical year and not calendar year. But overall, I think nationally, I think this table demonstrates, but it's a good opportunity to point out that the intent was for them to continue to step up MBQIP reporting requirements over time. And so they continue to ask for a little more and providing CAHs across the country opportunities to engage in public reporting programs to prepare them for and equip them for the future. So all to point out and reiterate that currently the minimum reporting requirements for eligibility is 1 core MBQIP measure for at least 2 quarters and at least 3 domains. So say that 3 times fast and see if you're still confused. 1 core measure for at least 2 quarters and then at least 3 domains. And so we're going to be walking through the domains next, and hopefully that provides additional clarity, and encourage you to chat in. I think just one final comment on this before we move forward would be, you know, I think we've learned really quickly that as hospital leadership or quality leaders or data abstractors have changed over time, although these are the minimum reporting requirements for participation, whomever leadership or quality leader at the hospital may have elected at some point to just report all measures for all quarters all the time. And that is certainly encouraged. You can always do more. I just want to reiterate that this is the minimum requirement. Okay, so I'll move us forward into just a quick glance at the 4 MBQIP reporting domains, and I know most of you are very familiar with these: the patient safety, patient engagement, care transitions, and outpatient. Again, these are the core MBQIP measure areas. They're further divided into 4 domains. Optional measures and associated details can be found in the link below. You can see that we put a blue X through the EDTC measure set. We didn't redo this table because if you access this tool at the Rural Center linked online, this is the information you'll see. They're in the process of updating these tools. Care transition remains an MBQIP domain, however, and as most of you are aware, we've been communicating a lot of information out regarding the measure transitions on EDTC. So we do want to spend just a bit of time digging into what are the changes to the EDTC measure set. There are new elements involved. It still remains a composite calculation. And for that, I'm going to pass it over to our clinical quality consultant, Michelle Bonson.
Thank you, Kate. I'm going to just spend a few minutes. I know that EDTC has sort of been something that all of you are familiar with, particularly because you have been using the HIN portal as a repository. And I'm happy to say that it's going to be nice to be able to not just say we are the repository for the information, but we are also here to provide technical assistance to you. So I think those two being put together are hopefully going to be a great benefit to you. So just a little background. In 2018, there were a series of groups and individuals that got together, and they convened a technical expert panel to take a look at the existing EDTC measures to see if they were still in alignment with sort of the change of the landscape of healthcare, particularly around health information exchanges and EHRs and so forth. And so what they decided was, due to the wired world that we're in now, it may be more appropriate to look at different types of measures and the things that were more applicable. And so they took those, and there used to be 27 elements, which I know you all know this very well. You're used to doing the abstraction and the reporting on that, but they moved it to 8. And I think the 8 here are displayed on your screen. And so they're really focusing on a lot of this. You'll see, the things that are really important. Medications. We know that medications are a huge part of everything that you're working on with reconciliation. So thinking about those medications and then the allergies or reactions, and as well as the medications that are administered in the ED. They also have the ED provider note. There is a mental status / orientation assessment, a reason for transfer and or a plan of care, any tests or procedures performed, and then the tests and or procedures. And one of the things I want to reiterate on that, there is a small typo here. Number 8 should be test and or procedure results. And this is an all or none composite calculation, and our portal is sophisticated enough that it can do that. So when you report on each of these elements, it will go ahead and do an overall composite calculation for you. So the number of patients who have a yes or NA for all elements over all transfers from ED to another healthcare facility. And sampling remains the same, the initial patient population remains the same, and exclusions remain the same. One of the things that they did clarify is the term, the definition of the term sent to better address communication via those exchanges, and they also clarified specific definitions of individual data elements. I am actually going to put a link into the chat box right now, and this is a great resource, and I encourage that you all bookmark this because it has so many great things that you will need as you work through. Make sure I got it in there. As you work through your EDTC works, there is the manual there. There are frequently asked questions. There's data collection tools. There's a manual that goes along with that and some training videos as well. And so right there, Kate just brought it up for me. Thank you so much, Kate. So that is the link that you can also get it in your slides. But I just wanted to make sure that you had this readily accessible, and we're happy to walk through any of those pieces with you and help you understand the new measures. And again, the sample size is the same, so those requirements have not changed. And that's what I have to offer on this right now without getting into the nitty-gritty of the measures, but I'm happy to answer any questions that you might have. And you can feel free to go ahead and chat those in. If you don't know right now kind of what you're thinking about or not sure and you've come up with something later, feel free to chat in. We're monitoring the chat box throughout this presentation.
Great, thank you.
Anything else?
No, I think that that's a great overview. Again, the IHG team did send out these measure changes in January and February, but we just, having you on the call today, we did want to draw your attention to it and make sure that you didn't miss it. The measure changes have been updated in the portal, and the measure set that would have been applicable to patients in 2019 has been retired from the database. And so that information, while has been stored and archived at IHG, is no longer accessible on the IHG webpage. Moving us forward, Lana from our team has chatted in to me to mention, thank you, Lana, that we have received a couple of requests from hospitals asking about the Excel document used to track EDTC. And if you have been looking for that, it is listed on the web page shown on the screen now at the Stratus Health webpage. You can also find that Excel data collection tool. You'll see it's right in the middle of this page. And again, the electronic link to this web page is listed at the bottom of the slide, and Michelle has also provided it in the chat. Thank you. So I want to move us forward here. EDTC is obviously just one of the measure domains for MBQIP, and so on the screen now, you're going to see a single page document that contains a chart showing MBQIP data submission deadlines through Q3 2020. That's currently what's available and published at the Rule Center, where you can find this web page at the link listed at the bottom of your screen. This, a PDF of this document was also included in the welcome email from IHG just a couple of weeks ago. And so we know that this is another kind of confusing thing to keep up with, because these dates all change based on the data source. And so we are curious and would love for you to chat in, if you're comfortable, kind of how your facility handles this. Do you set up kind of calendar reminders, or is it automated that your system will automatically pull or abstract these on the schedule? And particularly, if you have suggestions on how IHG could help support you in tracking these reporting deadlines, would it be helpful if we sent out reminders, et cetera? We'd love to hear and see your suggestions in the chat box. It looks like there is a question or a comment in the chat. Are we reporting all quality MBQIP data through the IHG database, or are we still needing to submit things through CAHl? Thank you. That's a really great question. And I see Michelle has responded. It is just the EDTC measures that will be reported through the HIN database. The measures that you normally report through either NHSN or CAHl, those things remain the same. That's an excellent question. And here in just a couple of slides, I believe we're going to dig just a little bit deeper into that piece, and hopefully we'll answer some of maybe the remaining questions. I will take just a moment to pause. That's a lot of information to review specific to data and minimum reporting requirements, and so I just want to pause a moment to make sure there are no questions up to this point that we can help answer.
Hey, Kate, it's Cassie. I just wanted to mention, too, on that slide right before this one, that PDF that you showed is also a really good resource under the reported to column. It kind of gives an overview of where you'll report that data to.
Yeah, excellent point. Thank you. Okay, well, not seeing any questions coming through with the chat, we'll proceed forward with sharing some of the key MBQIP resources and websites that our team has found incredibly helpful and is already using to help coach hospitals as questions start coming in. But like anything, you know, there is so much out there that you can access, and so that can become overwhelming. So we're going to focus just on a few that we think might be most helpful to you and your teams. So to start off with, the National Rural Health Resource Center houses key and in-depth information about the FLEX program. And IDPH provides guidance on eligibility, core elements, waivers, and also houses Cassie's contact information if you're needing it at a later date. And so between the two of these places, and IHC, of course, that we'll talk about in the next slide, you're going to find most of the critical resources you need to navigate this program, particularly when there's measure changes or reporting or changes in reporting requirements that may happen at a later date, or maybe if you're onboarding new staff with help conducting your data abstraction and or reporting. These are great tools to reference back to. Also wanted to share with you that IHC, at the first of the year actually, transitioned to a new online forum, and it's designed to share information throughout our industry and bring people together to drive sustainable healthcare transformation. If you've been involved in previous IHC initiatives, such as TCPI or the SIM or HIN program, this forum does replace the old Innovation platform that many of you had used in prior years. And we've combined all of our old platforms into one easy-to-use location that can be used by users from hospitals, clinics, and communities. And one of the features of this platform is an online resource library. You'll notice with the blue arrow at the bottom of the right-hand corner of your screen that we've added a bucket, I guess, in our resource library for the Iowa Flex Quality Program. And so as we get started and share tools and resources and have webinars such as this Flex call, we'll be archiving information and key resources and tools for you there, so it's all in one place if you need to access it at a later date. So to talk just a little bit more about the National Rural Health Resource Center, if you navigate to their webpage that's linked at the bottom of this slide, you'll see along the right-hand side of the screen this blue box, and we'd really recommend bookmarking this link as it's a gateway to many tools and resources. So in the next couple of slides, we're going to be digging a little bit further into what you'll find in this list of the items indicated in blue. So one of the first things we'd like to draw your attention to is from that site, you can find the MBQIP Quality Reporting Guide. And the guide's intended to help FLEX coordinators, critical access hospital staff, and others involved with the MBQIP program to help understand the measure reporting process. So for each reporting channel, information is included in this guide on how you can register for the site. So let's take CART, for instance. This guide contains information on how to register for CART, which measures you should report into CART, and how to submit those measures into the site. And that information is true for NHSN, et cetera. Also on this webpage, you're going to find MBQIP measure fact sheets. And these are really a great tool because they provide an overview of the data collection and reporting process for MBQIP. And the goal of the resource is to really capture the details regarding the measure and provide them in a basic one measure per page overview. So if you're familiar with the HIN and have maybe referenced like the HIN toolkit, this is kind of like that. It's really measure specific, numerator, denominator, inclusions, exclusions, really helpful for folks that are responsible for helping report this data, and then also understanding and interpreting performance data and identifying areas for improvement. So we'd highly recommend reviewing these resources. Additionally, one of the things that you'll find there at the Rules Center is a recorded training series, and it's really intended for CAHl staff with the responsibility for data collection. You can pick individual topics here if you have questions, or listen to the full series for a comprehensive overview of the process and to identify each measure population and abstract required data elements. And so one of the things our team loves about this video series is that they're very topic specific. So if you're looking for one thing, you don't have to listen to a full hour-long webinar. If you're looking for information specifically just on outpatient chest pain measures, there it is in a 20-minute video. And if you glance through this list, you'll notice that they're typically 20 minutes or under. And so really digestible format, really rich and accurate information. So we want to draw your attention to those great resources. Finally, one thing that I think is also confusing is you get information sometimes from Stratus or Rakita, and Robyn Carlson's sort of the reporting guru, if you will, for Stratus Health. And Stratus Health really is a national contractor, and their purpose is really to support IHC and other organizations who have been awarded support contracts to provide CAHs in their individual states with technical assistance as it relates to the quality improvement arm of Flex. Having said that, they do provide some really incredible education opportunities, and here are some of the ones coming up yet in 2020. We'd really encourage you to register for these. They're free of charge, but they are also recorded and transcribed. So if you do have a measure-related question, we would encourage you to seek out the IHC team first to see if it's something we can assist you with. But Robyn is an incredible resource and very supportive of the goals of this program. And certainly if it's something we're unable to assist with, we will liaison with Robyn to get you the answers that you need. I'm just seeing a comment in the chat. Can we send the links to the attendees? Absolutely. Following this session, like I said, we'll be recording and transcribing and then sending out a follow-up email to everybody registered for today's session with this slide deck so that you can have access to all the links that we're referencing here today. That's a great question. Thank you. Okay, so now we want to talk just a bit about communication. We know that we want to be able to get the right information to the right person in your organization in a timely manner. And so what we did when we sent out that welcome email a couple of weeks ago is we included a link to an intake form. Only one form is needed per hospital, so you can coordinate who is going to respond to that internally, but please do take a minute following today's webinar and make sure that someone from your facility has used that link to complete your intake form. If you haven't done so, here in the blue at the top of this slide, you can see that we've linked it here if you haven't had a chance to review it. But this intake form is really critical for the IHC team to understand at your organization who is doing what as it relates to abstracting and reporting, who's responsible for quality, and then outside of those individuals, who else at your organization do you want to make sure is receiving Flex quality improvement related program information. We want to make sure the right people are getting communications because we've received some feedback that potentially we might be able to make an improvement there. Also, this intake form helps us identify maybe some of the more immediate gaps and some of your more immediate needs, and we'd like your input so we can prioritize those for education and technical assistance in 2020. If you have any questions about filling out that form, again, would encourage you to reach out to any member of our team Our contact information will be listed on the last slide. We'd be happy to assist you. Another thing that we want to communicate readily to you, as we've engaged in some initial conversations with you all on this work, we're realizing how much confusion is out there in regards to, oh my goodness, how I know I put in MBQIP data into QualityNet or into NHSN, or I report to EDTC into the IHC database, but I have no idea necessarily how it gets back to me. So we've done two things. Our intent moving forward is to disseminate quarterly Iowa Flex MBQIP reports to whomever you determine on the intake form should be the recipient of those. We will be packaging your CMS inpatient outpatient data from QualityNet, your HCAHp's results, and EDTC measures into one report that we'll send out at the timeline shown on your screen to the left. So I think previously you may have received just a report with your HCAHp's data, and then maybe 3 weeks later received your EDTC data. And what we're going to do moving forward is trial packaging all of those 3 pieces and just disseminating them together on a quarterly basis. I want to add just one caveat to this as we test this model, is that as you'll see on the flow map to your right, this data takes somewhat of a lengthy path from the time that you report it to the time that it gets back to us and we're able to disseminate it back to you. And so while we intend for it to occur on this timeline, if it's delayed in the flow and delayed getting back to us, we will do our absolute best to return it to you in a timely manner and adhere to the schedule, and we'll be in communication with you if for any reason this schedule needs to be altered due to a delay in data. So I think that brings me to talking through a little bit of the slide here, the right side of this slide. We've put together this MBQIP data flow map, and we hope it helps hospitals understand when I enter data into QualityNet, where does it go next and the path it takes? And same thing for the information that you're entering into NHSN and entering into the IHC database. And so one of the questions that we've heard numerous times is, well, when I get reports back from Stroudwater previously, and of course in the future these will come from us, why does it have Telegen's name on it? And you can see that these particularly, well, I guess it's really all 3 do pass through Telegen. They, Cassie, I'll welcome you to elaborate on this, but Telegen actually has a national support contract for all states to process this data. And so that is why you see the Telegen branding currently on the reports you receive. They're not a support contractor of the Iowa program specifically, but they do process data from a national perspective. One of the things that IHC intends to do in the future, because we're waiting currently for HCAHp's data Q2 to come, and then we'll be pushing out your March 20 reports with the data you see on the left. In the future, by the June report dissemination, we're hoping to have some time with our data and analytics team here at IHC to see if there's ways that we can potentially reformat that raw data and provide it back to you in a form that maybe is more usable or digestible for you, and maybe is more user-friendly. So we'll likely be reaching out to several of you to give us feedback on potential new formats we could use to present data moving forward. I'm going to pause just real quick because I see some activity in the chat, and see if there's any questions here that haven't been addressed. It looks like we have somebody asking how will we receive the Flex intake form, and then an additional comment that says the survey only allowed to answer the hospital was doing 1 or 3 domains or activities. We are doing or reporting all 4 domains. Okay, thank you, Michelle, for that feedback. I think there'll be, towards the end of the survey, there's an opportunity for you to add additional comments. If you just add that note in the survey, we'll make sure that your current reporting plan reflects that. And then regarding the intake form, it looks like there's some questions regarding that. And no, this isn't intended for HIN. It really is intended for MBQIP because, you know, the data set is a little different than what we have for HIN. We want to make sure that we aren't just assuming that your contacts for Flex MBQIP measures are the same as they are for HIN. And that's the reason, one of the key reasons that we're asking for this information. If a member of my team, Lexi or Michelle, if you could add the link to the intake form into the chat, if you haven't already, I think that'd be great. Additionally, if you're trying to get the link to the intake form, we will include that link in the follow-up communication after this call. I want to make sure you all have that. The intake form link was included in the email, the welcome email I sent out last week. So it looks like some people had asked where did that get sent to. Oh, great. Michelle's added that intake form into the chat box. And then one final comment that CART isn't familiar to me. How do I know if my facility currently reports with CART? Kelly, we see your question, and a member of our team will follow up with you following this webinar to assist with your facility-specific question and request. So, Kelly, if you want to put in your email address into the chat, we'll be happy to follow up with you and provide you assistance. Okay. Any additional questions on kind of the reporting schedule, IHC's plans for disseminating quarterly MBQIP data moving forward, and or the MBQIP data flow map? Be curious after you all get this. Again, they'll be included in the follow-up communication from this call. So would be curious your feedback if you think that this is helpful or not, and if you would like to see more resources like this coming from our team. So with that, I'll move us forward, not seeing any other comments in the chat. We do want to mention Stratus and the Rakita group does put out kind of a monthly newsletter. It's called the MBQIP Monthly. It highlights current information about the MBQIP program and provides CAHs with information and support for quality reporting and improvement. It is produced by the Rural Quality Improvement Technical Assistance Program, or Rakita, by Stratus Health. And you can see on the right-hand side of this slide, here were some of the topics featured in the March subscription. Our plan moving forward is Rakita, all the hospitals across the country don't have to individually subscribe. Instead, what Rakita does is it sends it to each state support contractor. So again, that would be IHC moving forward, and asks us to disseminate that newsletter to hospitals in our state. So you can anticipate likely around, the 5th to the 10th of every month after IHC receives the newsletter, that you'll receive an email from our team with a link to join. Also, it's important to know that the MBQIP monthly newsletters are all archived at the Rural Center, and the web link for that is listed at the bottom of the slide. So if you ever feel like, gosh, I don't think I saw that March newsletter, you can always access their webpage and see them archived there. As mentioned before, IHC has moved to a new communication platform called iCompass, and we just wanted to make sure that if you haven't had the opportunity to join iCompass, that we give you the link so that you're able to sign up. We also developed just a quick training guide to navigating the platform. We think it's pretty intuitive and received a lot of great feedback, but want to make sure that you're plugged into the platform and are receiving all of the Flex quality information that we'll be archiving there moving forward. We're reaching the end of the content for today's session. I said earlier in today's presentation that she's going to be taking the first few weeks here and trying to figure out how we can design and present content for you most meaningfully moving forward. But we are moving quickly and have already set a date for the 2020 Flex Quality Improvement statewide meeting. We'll be inviting you here to Des Moines in the central part of the state on June 17th from 9 to 3 p.m. We're going to host this event at the IHA Conference Center. And the intended audience will be obviously all Iowa critical access hospital quality leaders, anyone who is active in your MBQIP data reporting or abstraction, we welcome you. We're still putting together the agenda for this event, but we'll try and do so quickly so you can plan accordingly, and we'll be disseminating the full event brochure when it becomes available. But please do mark your calendars now. We're looking forward to seeing you. Finally, we are really excited. Our team is really excited to take on this piece of work and to continue our partnership with Iowa hospitals working on the Flex contract. Our team information is listed at the link on the bottom of this slide. You can access our phone number and emails, and we really encourage you to continue reaching out to our team with any questions or technical assistance requests you may have as it relates to the MBQIP program. With that, I'll open it up for questions. If you haven't already chatted in a question and have one that you'd like us to answer before we conclude today's call, we'll give you a moment to do that. Not seeing any additional questions moving in. I want to thank you all for taking time to join the first Flex call. We appreciate your engagement in the chat today and are really looking forward to our continued work together in the future. My contact information is listed on the screen, and as previously mentioned, we'll be sending a follow-up email either this afternoon or maybe tomorrow morning with the recording link, slides for today, and all the important links and important resources shared today. Thank you so much for joining.